Hey girlfriend, this is Jan James. Welcome to the Hope After Breast Cancer podcast, where women who have endured breast cancer learn to have fulfillment over frustration, clarity over confusion, and faith over fear. We tackle the issues that many of our sisters face after a breast cancer diagnosis, from brain fog to fear of recurrence, from menopause to sex after breast cancer. This is the place to learn how to have hope after breast cancer. So strap yourself in. Welcome to the Hope After Breast Cancer podcast. Hi everybody, it's Jan James from Hope After Breast Cancer. I have the privilege of introducing you to our guest today. Dr. Kelly Casperson is a urologist, an intimacy expert, a top international podcaster, yay, and best-selling author, and we're so glad to have her here today. How are you, Kelly?
I'm so great. Thanks for having me.
Oh, I'm delighted to have you and cannot wait to have this discussion. So let me start by reading something from Kelly's website to get us started. These are Kelly's words. I teach women about sex. I'm a urologist, a woman, a wife. I have advanced training in pelvic medicine and surgery. Women cry in my office every week. Their confidence is broken. They don't desire intimacy, or they desire better intimacy. No tools learned in medical school prepared me for the wave of women that are hungry for help and education. So I pursued even more education, sexual health, intimacy, the science of desire and female sexual response, coaching, and mind work. I am self-taught. Now it's my job to teach others, because I can't teach women one-on-one in my clinic and expect to touch a drop in the ocean of this need. Please join me, because you are not broken. And that is the name of your podcast, and that is the name of your book, You Are Not Broken. Tell me why you chose that name.
I kept saying it over and over. And so it kind of just birthed itself. Like once I started learning everything about normal female sexual function, for example, a woman would come in and she'd be like, I don't have an orgasm with penis and vagina sex. And I'm like, well, that's normal. You're not broken. Right. And I think people, like maybe the normal response is like sympathy of like, oh, I'm so sorry. Right. But to me, I'm like, well, why would you? 70% of people don't. Like you'd be in the minority if you did, right? So it's like, you're not broken. And then another woman comes in and she's like, I just have a different desire than what my partner has.
Right.
I'm like, well, that's normal. You're not broken. You have two people. Of course you have different desire levels. That's not a problem, right?
Right.
And, I just kept saying over and over, you're not broken. You're not broken. And so I was like, people are more normal. They just don't know it because they don't have any education. And I find just a little bit of education goes so far into being like, oh, yeah, my lived experience is the lived experience.
Right, exactly. No, and I would tell you that personally, I've actually used that term that I'm broken, that my vagina is broken, more than once. And then I think, as I'm 11 years out from my original breast cancer diagnosis, along the way, as we've gotten more and more contributing experts that could educate me about my body, I've come to realize it's not that I'm broken, it's that I have a medical condition or two that need to be managed. And it's just like every other medical condition. And it's not that my body has betrayed me. It's none of that. We all say these words that can become ingrained kind of in our psyche. And I think it's so damaging. So we got to watch,
Totally.
Remember how our moms used to say, watch your language over there. So
well, it is. It's, what we think is what we believe, and beliefs are just a set of thoughts that we think on repeat until we think it's fact, but it's not a fact that you're broken. Right. And it's like, take the medical condition, it's what we make it mean, instead of saying, well, no, I am a body. I have a body. My body needs this now.
Right, exactly. So it feels to me that you're really in your sweet spot right now. So you started as a urologist, I guess, and now you're really focusing on this aspect of health. And I read that your mission is to empower women to live their best love lives. So how did you really get there?
Oh, I had a patient change my life. I was 7 years in. I was just doing general urology. I tend towards female. I do a lot of incontinence stuff and prolapse stuff, just because as a woman, women want to see me, and that's what female urology is. And I was getting a little bit bored, which is the perfect time for, depression or reinvention. And a patient that I knew for years came to see me for a yearly follow-up. We were checking on it was actually a cancer diagnosis, but she'd, survived that, that was behind her. We just see her every year, kind of chit chat. And I really got to know her. So I was very bonded with this person, which is why I think it was so influential to me. And she was crying in my office about her marriage, and great marriage, loved the guy, didn't want to have sex, didn't have sex, felt so bad, felt bad for him, and was crying. And I grabbed a box of Kleenex and gave it to her, and like lightning struck my head. And it was like, all I have is a box of Kleenex. Is it true? Because what I was told in residency was women are complicated. We'll never figure them out. The gynecologists are taking care of them anyway, so we don't have to deal. And basically that's not our job. And I was like, well, we give Viagra out like multivitamins. Who's taking care of the people who are sleeping with the people we're giving the Viagra prescriptions to, right? What happens when you take a 60-year-old man and now you give him a 2-hour erection? He's married to a woman who's been through menopause and isn't on vaginal estrogen. Right. She might be very uninterested in a 2-hour erection, especially if it's been a sexless marriage for 5 years.
Right.
So I just really started getting curious and started reading everything I could, started going to the Ishwish conferences, started learning, like, we actually know a lot. And we don't get a sex education, but that's not entirely true. We kind of get a crappy one. Like Hollywood tells us plenty about how we're supposed to behave and how we're supposed to have sex and how we're supposed to have an orgasm, but it's all wrong. Right. And so once I started learning all that and telling women like, oh, you're not broken, that's normal. Yeah, that's normal. Oh, you've never had an orgasm even though you've been married twice? Yeah, 10% of women have never had an orgasm.
Right.
Just kind of really normalizing people instead of thinking like they're the only broken person. And this voice in my head was like, you have to talk. And that was the birth of the podcast 2.5 years ago.
How wonderful. No, that's good. And boy, your podcast is just fire. I learned something from every episode for sure. And just really appreciate you taking questions and just because those are all real life scenarios that, I'm listening to you address, and it's just, boy, it's really, it's very inspiring to me to have someone so dedicated to turning around women's sexual health. It's a big deal. So that's awesome. Okay. So let's see. I wanted to just say that I read on your website and this is something that really hit me. And I think I said it a little bit earlier. You wrote on your website, the thing I say all the time, you are not broken. There is absolutely zero upside to telling ourselves that we're deficient or lesser than. Why would we want to tell our bodies that? They're wonderful as they are. They are good enough and lovable as they are. You might have a medical condition and are not broken. Wait a minute. Let me say that again. You might have a medical condition and you're not broken. So there are so many women in our group, Sex After Breast Cancer on Facebook, that understand that they have to take action in order to create a different scenario in their sex lives. But then there are other women that are just, I don't know, like I want to shake them and say, come on, let's do this. But it's like they feel like they're forever broken. And do you believe that taking action is critical to kind of turning this situation around?
Yes. Okay. Nobody's coming to save you, my friends.
Right.
Right. Like we think like it'll just get better on its own, or maybe it won't be a big deal the longer it goes, or maybe there, lots of reasons why people don't take action. Right. But it's like in the taking of the action, that's where change comes from.
Yeah. Well, it's kind of taking your power back because you have the power to make change, but it's going to take some deliberate action on your part. So what kind of forms does that action take?
I think you find the podcast, read the books, talk to people, go to your doctor, see if it's a good fit. If it's not, go to a different doctor.
Indeed.
I always say, like, go get a second and third opinion. By the fourth opinion, if they're telling you the exact same thing, maybe they're onto something and you might, be wanting something that's against medical advice. But it's amazing how many women contact me now because I'm pretty big on Instagram, and they're like, I'm on my third, I'm on my fourth. Because of you, I took this paper in, and to me, I'm like, I teach you here's the papers. Here's how to talk to physicians. Because to me, I'm like, I'm a physician. I know what works when people come in and they're like, hey, I've been reading this. I saw this paper. Can we just try this? Maybe for a couple of months. And then if it doesn't work, we'll stop it. Like if somebody says that to me, I'm like, oh, they're game. They understand there's risks, but they're not going to continue if it doesn't work. Like, learning how to talk and ask for what you want. Mm-hmm. And then, I had a woman come in, her physician had taken her off of hormones. And I said, well, why? And she's like, well, I don't know. And I'm like, you didn't ask why your prescriptions were stopped? And she's like, well, I didn't want to be like mean or argumentative. And I'm like, that's not mean or argumentative. That's you understanding what's happening to your body,
right.
And really empowering people of like, just don't come across mean and argumentative, mm-hmm. like, but you have the right to understand why a medicine's being started or stopped.
Right.
It's at the end of the day, this is your body. Nobody's coming to save you.
Mm-hmm. And I do feel that I'm 63 now. I was taught you must listen to authority, obey authority. Authority is, okay, so doctors, I think, are under that umbrella. Yep. But I think over the years I've gone, well, they put their pants on one leg at a time too. They're just people. And there's a reason why they call it the practice of medicine. Things are changing all the time. Different doctors have different opinions. And so having a doctor that you can communicate well with that gets you and you get them, I think is so critical. I am also an advocate for our women to, if you have a doc, whether it's a gynae or an onc or whatever it is, that is not, where you feel like you're not getting each other, it's time to change ships, time to go get somebody else. So that's great. Yeah, no, I agree though about the action. We've got to do that. And I think that finding, I didn't really understand until recently that urology people are really part of the equation. I didn't have that piece of the puzzle. Mm-hmm. And now I go, oh my gosh. Okay. So with that being said, can you explain what GSM is? I used to work in mainstream media. I worked on the sales side, the dark side, as they call it. The GSM was the general sales manager. So every dang time I see that now, I go, oh, well, I'm back in my media days. But it's really not. What is it? Genitourinary syndrome of menopause? Good gravy.
It's a mouthful.
It is.
But our only other choice was, and this is what it used to be called, was vulvovaginal atrophy. And people don't like the word atrophy. Mm-hmm. So and the other thing about vulvovaginal atrophy is it doesn't really tell you why, right? Mm-hmm. It's not as a descriptive of the problem. And so genital urinary, it includes the vulva, the vagina, the urethra, the bladder, because all those body parts get affected in the pelvis by low estrogen that happens because of menopause. Wow. So GSM is actually, it explains it a lot more than just saying like, well, you're atrophic. And you're like, well, I don't know, how'd that happen?
Right, exactly. No, exactly.
So it is a better name, but it's a mouthful.
Okay, so like in my research or just my learning, so GSM would incorporate genital symptoms like dryness or burning, and then sexual symptoms, which all my girls, lack of lube, lack of or discomfort or pain, those kinds of things, right? And then urinary, Hi, Jan James here. Prolapsed urethra recently diagnosed. Thank you very much. So how are all of those symptoms that we're talking about under the GSM deal, are they all related to decrease in estrogen?
Yes.
And do they only happen in women with breast cancer?
No. 50 to 80% of women who go through natural menopause will experience GSM. The problem is that nobody even knows in our country what menopause means, let alone that there's pelvic symptoms of menopause that don't happen the day you start menopause. They can really start to rear their head like 5 to 8 years afterwards. So now you're really not connecting it to menopause because now maybe you're 58 and menopause was 50, right? Women don't really think, and we're not taught, like there are consequences to years upon years upon years of no estrogen, which is when you really start seeing the pelvis stuff show up. It's not the day that you haven't had a period for a year.
Right. Well, and I'm a perfect example of that. I went through menopause while I was in treatment, not because of treatment. I went through natural menopause at the same time as treatment at 52, and now I'm 63. So now I have a prolapsed urethra. Mm-hmm. And a few other things that I think I'm headed to pelvic floor therapy, which I want to talk about that as well.
So good.
But I appreciate that you call us vulva owners. I just wanted to put that out there. I love that. So, so our breast cancer community, most of the women have either gone through natural or medically induced menopause. So this relates to them, to most of them. And so I appreciated understanding from your podcast that GSM is really considered this kind of progressive disease. It's not going to go away. It's not going to get better. And your lack of action will impact that one way or another, right?
Right.
So can you talk about women that may not have a sexual partner or are not having sex? Should they be taking care of their vaginas?
Oh, I think yes. I mean, this is fascinating. Is that, women will come in and I'll be like, first of all, when they come in and they're 62 and they have a prolapsed urethra or urinary frequency or whatever they have, whatever their GSM is looking like at the moment, I always say, oh, you're right on time. Of course you're seeing me at age 62 and you went through menopause at 50. So I really normalize it. I'm like, hello, yes, this is where you are. Not like, how did we get here? And I'm so confused by this. I'm like, no. This is when it happens. You're right on time. Just to normalize it, right? But then, so many women are like, well, I didn't know I needed to be on vaginal estrogen because I'm not sexually active. And I will literally look at them with like a blank look on my face and be like, why do we care about the man in this scenario? Why are we talking about sex right now? Because women so much identify their vagina as something that I have sex with somebody else. And if that person's not around, I don't need to take care of my vagina. And it's like the vagina, number one, is the organ that prevents bugs from our, rectal poop microbiome going into our bladder. A healthy vagina prevents recurrent urinary tract infections.
Right.
It's a huge reason to be on vaginal estrogen. When you're on vaginal estrogen, just, for the people in the back, but the vagina becomes acidic. Vagina loves being acidic. That's where lactobacillus thrive. E. coli actually hates an acidic vagina, right? And so it's like getting the vagina healthy actually prevents recurrent urinary tract infections. So yeah, I look at people with like a profound disbelief of like, why were you bringing up sex? This has nothing to do with a man. This has to do with your pelvis. But women I see it as they give away their power. They give away the need to take care of themselves because there isn't somebody else using their pelvis for something. And it blows my mind when I hear them say that.
Right. I've heard some docs talk about the fact that, well, you put moisturizer on your face, don't you? Don't you? I mean, maybe you should moisturize your vagina. You think so? Because it's important.
It's skincare. Yeah, and I bring that up. It's like the face skincare industry in this country is like about $4 billion.
Right.
Most people will put not one product on their face, but multiple.
Right.
And so I'm like, well, do you care about skincare? Do you wear sunscreen? Do you wear seatbelts? It's preventative medicine. But again, Western medicine's not great at preventative. Right? We like to treat disease, not prevent it.
Right.
And so I think a lot of vaginal estrogen we're not at the preventative place yet where I think it should be preventative, but usually you're suffering and then we're putting you on vaginal estrogen.
Right.
To me, I'm like, what an amazing idea to just say, hey, you're 50, here's your colonoscopy, here's your mammogram, and here's your vaginal estrogen.
Okay, but just wait a minute, Kelly, because I'm from the breast cancer world. Okay. So my oncologist, God bless her, and I love her, she saved my life, right? Said, Jan James, you're ER positive. You stay away from everything that is estrogen based. No edamame, no lavender, no soy, none of it, over and over and over again. I remember years, I'm 11 years out now, where Premarin commercial comes on the TV and I wanted to throw something through it because I thought, how can they push vaginal estrogen without knowing that it causes cancer? Well, then this year I read the book Estrogen Matters, and here it is. It's always by my side on the recommendation of one of my doctors. And I'm so frustrated. I loved this book, and I actually have been reading it over and over again, and it reads like a thriller, and you should buy it even if you are not a medical person because it's easy to read. Dang it, like more than 20 years ago, one stupid clinical study by the Women's Health Alliance said that estrogen causes breast cancer. and the study was flawed. And there has not been one study since then that says anything else. And so we've been taken, ladies. We've been told the wrong information. And it's taking a long time for the medical community to come around. So do you disagree with anything I'm saying?
No, I mean, it's fascinating, right? Again, it's the blank look I give people because they're like, well, estrogen causes cancer. And then I do my blank face thing and I say, it does? Where does it say that? And people can't tell me. That's how profound the myth is. It's really permeated society when you can't tell me where you saw that, where you read it, and you don't know. You just heard it somewhere. And what's super curious to me is like, you're not going to question that. You don't know where it comes from and you're not going to question it. And again, I'm a physician, I'm a researcher. Like that's the way my brain works. Maybe I have a little problem with authority. I don't know. But I'm like, you don't know where it came from, but you won't question it enough that you're going to suffer because you won't want to take any estrogen products. And I truly believe like the worst thing we did is make women afraid of something that their body naturally makes.
Right. Totally.
We don't tell men that there's literally a Nobel Peace Prize looking at the association of testosterone and prostate cancer. A Nobel Peace Prize. Not Peace Prize, sorry. Science. It was medicine. Medicine. Nobel Medicine Prize. Mm-hmm. We don't tell men that testosterone causes cancer. There's a Nobel Prize looking at the connection. We don't tell men that because it's not really all that true. Right? And so that's the thing is like we've just made a whole world of scared women, and I wouldn't say that we're all the better because of it.
Right. And it's really messed with us for all of these years, and it's infuriating to me. But I feel like Johnny Appleseed. I'm Paul Revere. I'm like out there screaming, "Hey, vaginal estrogen!" I started vaginal estrogen about 6 weeks ago or so. I cannot wait. I was diagnosed with severe vaginal atrophy like 3 years ago. And of course, what that did to my minimal sex life was kill it because I was like, well, I'm broken and there's nothing to do about it. And I was told there was, sorry. Well, that's because the doctor didn't know, right, how to turn it around. Well, now I said to my husband, look out, here I come. So anyway, so that's good. Okay. That's awesome. Did I hear you say that all women over 50 all women should be using vaginal estrogen?
I mean, it's probably a broad brush. I can't give you a paper. I can't quote it. Okay. But again, I'm looking at preventing. You look at what recurrent urinary tract infections do. They land people in the nursing home. People die. People die because of recurrent urinary tract infections, right? Wow. People probably shorten their lives because they're getting up to pee 4 times a night. Right. Like all these things of like, there's a consequence to using medications. Some medications have side effects. If you use vaginal estrogen, you have a slightly higher risk of yeast infections in the beginning. There's always risks, but what we don't do is we don't say, what's the risk if I don't do these things? Right. So again, it's a broad brush. I think I'm at the head of the curve where I think it's a preventative medicine, but it's like, do you wait till you have skin damage on your face before you start using sunscreen? Like, no, we're going to try to prevent the damage.
And so there is no data that indicates that it causes breast cancer.
Correct.
And you wouldn't exclude the women I serve from this information. You would encourage them to see their gynecologist and talk through it.
Yep. So the American College of Obstetrics and Gynecology, the ACOG, actually has a position statement on the use of vaginal estrogen after being treated for breast cancer. So I'd say refer to that. It's actually in my link tree on my Instagram if anybody wants to go there and get it. But refer to that, bring that in. I think the only people now that it's the only people, if you're on an aromatase inhibitor, get an okay by your oncologist. Because aromatase inhibitors really do try to block every little piece of estrogen. And it's theoretical. We don't know a lot, but that would be the only population where I'm like, I'll give this to you, but you got to get an okay by your oncologist. Now in my town, the oncologists are like, yeah, it's fine. And we say use as little as you need to get the job done.
Right.
We just want it, whatever your symptoms are. We got to break the cycle of UTI. We got to make it stop burning when you're peeing. We got to make you not have to pee every 15 minutes. Like, this is quality of life. And as you know, a cancer survivorship, quality of life matters. We're curing people of breast cancer on the best percentage we've ever done it before, right? People are going to live for a very long time. Now we have to care about their quality of life.
Right. Right. And I think that really has been something that I've had to learn again from the actions of my community. I was originally freaked out by hearing women say, well, I'm going to use vaginal estrogen because my doctor says it's okay. And again, I had been, it had been pounded into me that that was the wrong move. And I was just devastated about it. But then my women have taught me about quality of life, that it's true. Like, if your sexual life is important to you and your partner, then by all means, you've got to weigh the risk reward on that and everything. I want to just mention that vaginal estrogen is really different than hormone replacement therapy or bioidentical hormone replacement therapy, right? Can you explain how one is systemic and one is localized?
Yep. So they actually call it low dose vaginal estrogen therapy. I think they just like to give it a label to make it less scary. I tell women, I'm like, hey, I wish, since you're so freaked out about estrogen, I wish this wasn't called estrogen.
Right.
Call it vagina juice, whatever.
Right.
But like, make it something, make it, I don't know what you want to make it, but it's literally, the name is so loaded because we are so afraid of it. But so let's think about birth control for a second. Hormone replacement therapy, or what they call menopause hormone therapy now is the proper term for it, MHT, is on the order of about 10% as strong as a birth control pill. So it's already not even close to what a birth control pill is. Now we take low dose vaginal estrogen therapy. You use that for an entire year. It's the same amount of estrogen as one pill of 1 day of menopause hormone therapy. Mm-hmm. This is teeny, 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 tiny amounts. And again, I tell women, I'm like, I'm not trying to get your whole body to have estrogen. I'm just trying to get the bladder, the vagina, the vulva, the structures that became who they are because they saw estrogen are now suffering because they're not seeing estrogen. That's right. It. We just want to treat those organs.
And so, and there's, one of our experts had said to me that if you do I can't remember what they call it, but there's like a front loading dosage or dosing that is usually recommended of like, if you do 10 is it micrograms of low dose estrogen, is that what it is, CG or milligrams?
It depends. Yeah, it depends upon if you're using a pill or a cream.
Okay, like I have a pill, so what am I getting?
Oh, I think Vagifem is 10 micrograms.
Right. Okay. So yeah, I was just going to grab the box. So I have the pill, and it has an applicator, goes in your vagina. For those of us that have prolapse, pro tip, just give your muscle a little tweak and you can actually get that pencil size applicator in there. Anyway, so didn't know that up front. So I was like, it's closed. No, it was it was the problem. Anyway, but using that, well, here's my personal story. I was supposed to use it for 2 weeks, just to kind of jumpstart everything. And let me think about this. I want to say I started on maybe a Sunday, and by the next Saturday, my husband sat me down and he said, do you know how you yelled at me in the grocery store parking lot the other day? I said, yeah, didn't we get through that? He said, yeah, we did. Do you know how you started crying because your computer wasn't working yesterday? Yeah. He said, I just put it together. You're like a 13-year-old who's going through puberty. It's the stinking estrogen. And because I was so emotional, and I'm not that way. And so I actually just texted my gynae and said, hey, I'm going to stop front loading. I'm going to just do the regular 2 times a week. And everything since then has been rosy in my marriage. So that's fine.
Yeah.
So,
I don't do front loading for any of my patients.
Really? Okay.
Yeah. Again, like I always like to say on podcasts, like, I'm not giving anybody medical advice. This is my personal opinion. But to me, I'm like, they get too many side effects for that much. Mm-hmm. Right. And I don't see the point of it. Yeah. Especially like your pelvis hasn't seen estrogen for 10 years. Why am I giving you 2 weeks of a whole bunch of it? So to me, I'm like, I want it to be sustainable. I'd prefer it if nobody had any side effects. So I don't front load on anybody. I can't see a reason to do it.
Yeah. Hey, before we started recording, you and I were talking about what's happening in the UK. Do you want to tell the girls about that?
Yeah, September 2022, vaginal estrogen is now over the counter. Or it got authorized. I don't know when, if you're over there right now, don't go to your local pharmacy and look for it. It might not be on the shelves yet, but they just announced they're going to be over the counter.
It's so cool.
I think
No,
it's over the counter in Israel as well. I think it might be
Oh,
over the counter in Finland. There's a couple of countries where it's over the counter. That's how
wow.
it is, my friends. It's over the counter.
That's the way it should be, but we'll see how long it takes to be here. So, right. Okay.
I don't hear anything. I don't hear any talk of that happening in America right now.
Mhm.
And I would probably be one of the first people to come across the memo, the way that I the circles I run in, but I don't see that happening, and I think it's a big barrier.
Mhm.
That it's a big barrier that I have to go to my doctor. I might have to convince my doctor,
Right.
let alone the cost. The GoodRx app, for people who don't know, GoodRx, it's an amazing app on your phone. Type in your zip code, type in vaginal estrogen, cream, pill, whatever you want. And they will find you the cheapest cash based in your town. And mine was 10 times more expensive if I went through my insurance. So
Right.
2022, your insurance is not always the cheapest way to get medicine, and that is a brand new memo for people. We thought we got health insurance to have cheaper meds.
Well,
It's not the way it works.
let me tell you this story, going slightly off topic, but we're a cash pay house on pharmacy, okay? Because we're in a healthcare co-op. So the co-op doesn't do meds. Okay, so I get an email a month ago or so saying Amazon's got a pharmacy now. I'm like, oh, that's interesting. Get this. I have 2 meds from my cardiac doc and I still can't even understand this. Both of them, 30-day supply, $3.80. 6-month supply, $6. $1 a month for cardiac meds. $1 a month.
Yep.
So I would look at pricing on Amazon Pharmacy in addition to GoodRx. I think that they're both really great choices. But yeah, go shopping for your meds right now, because there's apparently something going on in that world, right? So that's good.
Yep.
Okay, so say women do vaginal estrogen use. What kind of benefits are they going to see, and how long does that take?
I think it takes about at least 6 to 8 weeks,
Okay.
because this is not a Band-Aid. This is giving you better new skin, right? And it takes a while to regenerate new healthy skin.
Right.
So I think that they're going to see more moisture, less dryness. They're going to see hopefully less pain with sex, although pain with sex is complicated. There can be many reasons for it, is what I mean.
Right.
Improved urinary frequency urgency can help your urethral prolapse. My comment, just as a urologist on urethral prolapse, is I put the cream directly on the urethral prolapse. I don't think a tab in your vagina is always going to cover it. Just in my experience, I'll see a lot of women come in and they'll be like, oh, I'm in this tab in my vagina, and they still have urethral prolapse that hurts or bleeds.
Good to
when they
know.
wipe.
Yeah.
So something to consider.
Our common friend, Rachel Rubin, told me to for sure get the tab because the cream was too messy. But I get what you're saying about that.
Yeah,
See,
I don't think it's messy.
Yeah. So,
Especially for the prolapse people who have like extreme prolapse, I think it can be very challenging to put something in the vagina, and the cream, you can just wipe it on the prolapse.
Right.
If it's one where it's protruding.
Okay.
That's the nice thing, is like there's a lot of different options.
Absolutely.
I have some people do the tabs and then they do the cream on the urethra, the clitoris, and the labia minora because they want to keep those structures healthy.
Right.
So there's so many different ways to do it.
Right. You can do it. So no, that's awesome. So that's good. Okay. So let's talk about pelvic floor for a minute. The mysterious industry of pelvic floor therapy, honestly, that we should have been told about when we were like 12, is, I feel like I'm becoming an evangelist for pelvic floor, honestly, and I haven't even had my first appointment.
Good.
So no, I'm learning so much about it, right? So one of our pelvic floor experts told me it's about bowel, bladder, balance, and sex. Would you agree with that?
Yep.
Okay. And then she actually talked to me the other day about it's about lymph system too, that those muscles help move the lymph through the body as well when they're healthy. So, there's myriad reasons why you should have a healthy pelvic floor. And the strangest thing that I learned, holy smokes, I know you're a doctor. I'm saying this for everybody else. Do you know that there are no bones that are holding up your body, that there is just the pelvic floor muscles that connect from hip bone to hip bone and from tailbone to pubic bone? Now, it's just a basket of muscles. And that's another thing that we should probably learn to take care of, because it's supporting everything in your structure. I was like, what? And I was trying to envision those life-size, skeleton pictures from my doctor's office and go, so there's nothing there? I guess there's nothing there.
You got to get a baby's head out.
I mean, that is shocking. So yeah. So how does that impact our women with breast cancer and our women that have low estrogen or no estrogen left in their bodies? What are you seeing in your practice?
Well, what we do know is through the menopause transition, we lose about 2% of our bone mass and our muscle mass a year, right? And if you're not actively lifting weights, eating appropriately to feed your muscles, really working on your muscles and your strength, it's just going to slowly diminish over time. And when we see decreased muscle mass, we have troubles with balance, right? We actually have trouble with insulin resistance. Muscles are a huge sink for glucose and really help with insulin processing. Muscles are very important. But what we've done in Western medicine is we're very organ centric, right? Like you have a pain in your pelvis, you usually will try to identify the organ that hurts. Oh, I think my bladder hurts. I think my uterus hurts. I think, my colon hurts. We never say, I think I have a tight, transverse peroneal muscle.
Right.
We're not muscle centric, especially doctors, right? Like who's the boss of the muscles in the doctor world? There isn't one. It's really the physical therapists that are form, function. Muscles have to be strong, but they also have to give, right? They have to be able to relax. Some muscles are under tension. Think of tight shoulders, right? Of like, if they're under tension, if they're too tight, it can also hurt. So if they're too loose, you can see some prolapse issues, trouble evacuating, right? Because you got to poop through these, you got to pee through these, you got to have a baby through these, you have to have penetrative intercourse through these. Like they really need to be dynamic and in great working order. It's not great if they're too loose. It's not great if they're too tight. But again, if you have a pain in your pelvis, you're usually going to pick an organ. Same with your back. I see so many people, they're like, my kidneys hurt. And I'm like, you don't know what kidneys, nobody knows what kidney hurt. Unless you have a kidney stone, that's your kidney hurt. But that's back pain, my friend.
Wow.
But we're very organ centric in the way we think. We don't think about muscles.
That's a good point. So let's see. So the kinds of things that we can see as far as prolapse are bladder, uterine, urethra.
Yeah, I mean, it's interesting how we talk about prolapse, right? Because people are like, my bladder's falling out. It's like, bladder is my favorite organ. It's never the bladder's fault. The bladder's not deciding to leave your body. Stop blaming the bladder. It's really the walls of the vagina.
Right.
So the true correct term is vaginal prolapse. Now we say the site of the prolapse is the organ that's behind it.
I see.
Right. So if it's the anterior wall, that's the bladder, it's a cystocele. If it's the back wall, that's posterior, that's the rectocele. If it's the top, then it's uterine. Or if your uterus has been removed, then it's usually small intestine. It's called enterocele. But it's not technically accurate to be like my bladder's prolapsing. No, your bladder's just behind the wall of the vagina that's falling out.
But that's the whole point when I'm talking to you about using the applicator for the vaginal estrogen. And it was like I tried to get it in my vagina and I'm like, well, what's going on? And then a couple days later I went, oh, I wonder if it's a muscular thing. Can I squeeze that muscle? And all of a sudden, like my vagina opened up. So obviously the musculature pulled what was pooching into my vagina back so that, I had that opening. But it's shocking to me that I just haven't understood I just don't feel like we had any education about anything in the pelvis,
Well, no, because what do we call women who explore themselves? We call them bad names, right? Don't touch yourself.
Right.
Don't, the only bad girls do that. And then we've got all these women who are like, I don't know anything about my body. I wonder why. And we're like, well, because we told you not to touch it.
Right. Which is really
we
sad.
shamed you into you having no education.
You'll be proud of us in the Sex After Breast Cancer group because we have been talking a lot about solo sex as one of our practitioners talks about it. to be able to use a vibrator to get blood flow to the various aspects of your pelvis and your vulva region. So I think that it's really somewhat demystifying things for people and giving them permission to go, oh, so that's really like a medical, I'm helping my body by doing that. It's not even just using a vibrator, not for pleasure, but to stimulate that skin and that tissue in order to get it healthier is what we're talking about a lot. So we're really glad about that. So that's awesome. Okay. So what else? Okay. The last thing I want to talk about is just, I'm so excited that I found this I think in maybe one of your downloads, but you are so great, Dr. Kelly, about talking about limiting beliefs.
Oh yeah. I love them.
Oh my gosh.
Who doesn't want to talk about this? It's the best thing ever.
I just felt like, oh my gosh, you're my people. So tell us, okay, for those that don't understand limiting beliefs and certainly the ones about sex, can you talk to that?
Yeah. So a belief is just a thought we think over and over and over until we think it's a fact, right? When really, if you write down everything you're thinking and then you say, only circle the things that can be proven in the court of law, you're mostly just thinking opinions all day long. Right? Which is what our brains do. We've got to figure out the world and realize if it's safe or not. It's all just normal brain behavior. You're not broken. There's nothing wrong with you. But the things you think are truth tend to just be opinions.
Right.
Which is fascinating to think about. There's a lot of personal growth in that. But so you think your thoughts and we think they sound like really true, but you realize these thoughts are they serving you or are they not serving you? And where this came in with sex was like, as a urologist, I can make your pelvis pretty darn healthy, right? We get you the pelvic floor physical therapist. We get you on vaginal estrogen. I tell you to use a lube. We figure out where your clitoris is. Like we got the pelvis in good working order. But if you think sex is dirty, it's shameful, it's difficult, it takes too long, it's never any fun, those are all limiting beliefs. Doesn't matter how great your pelvis is, you're still going to have a mediocre sex life, right? Pleasure's not for me. That's just extra. What's the point? Right? These all sound very facty, but you're like, no, it's your opinion to think that way. What if you thought the opposite way? And do you think the people who think the opposite way might have a better sex life? Right? So it's like, if you look at the people, and there's books published on this, Magnificent Sex by Peggy Kleinplatz, basically researching the people who have magnificent sex lives. They're not sitting around waiting for spontaneous desire and, wishing somebody came to save them and wishing it was easier. It's like all those limiting beliefs, they're not going to get you so far.
What's the name of that book?
Magnificent Sex by Peggy Kleinplatz.
Okay. I will put that in the description so that women can find it. It's
a great book because I think so many women, especially women, don't understand, getting off topic, but women don't understand the difference between spontaneous desire and responsive desire. Responsive desire is very normal, can be the majority of women, especially in a long-term, monogamous heterosexual relationship of like, you're not actively seeking out sex. The desire for sex comes during it or after it. I just had great sex. And then you're like, that was so great. That was so great. Why do I always forget how great that was? Will you remind me how great that was? I always forget how great that was. She's desiring sex after she had sex.
Interesting.
So many women don't have a great sex life because they're sitting around waiting to desire it.
Right.
Not realizing that desire can come during and desire can come after. And desire doesn't have to come at all. You just say, well, I want to eat vegetables in my life and I want to be somebody who's fit. But if I sit around waiting to desire vegetables or waiting to desire to work out, that lifestyle is never going to happen. Right? Again, it's nice to compare sex to other things, but it's like, if you look at athletes, they're not at the top of their game because they have spontaneous desire for it. They're like, I'm going to put in the work. I'm going to figure out how to be the best. I'm going to involve this. I'm going to have my life be involved with this. Right? And that's how sex life is. And the wonder, getting back to Peggy Kleinplatz's book, that book is not like, well, all these people have great sex lives because they spontaneously desire sex. Like, spontaneous desire does not exist in the book on the experts at sex. And I think that's very telling because so many women just sit around not having a great sex life because they don't have spontaneous desire. And that's where my book comes in to be like, you don't understand, just a little bit of education can get you so far, right? Like, they don't even understand that, like, they're limiting themselves wishing for something that is not even necessary.
Yeah. I am delighted that I can tell our listeners that if they go to your website, kellycaspersonmd.com, that they can download the first chapter of your new book, You Are Not Broken. And I loved it, and we'll be ordering your book. Where can they buy the book?
Amazon.
Okay.
Yep. So
awesome.
we got ebook on there and paperback hardcover. I just read the audiobook this month, so it'll probably be out in a couple of months.
Oh, yay for me. I may have to wait for that.
Yay for the
I
audio
love
people.
audio. Good. Yeah. Okay, good to know. That's awesome. That's great. And then how can people connect with you?
Oh, Instagram is where I'm most active. So Kelly Casperson MD on Instagram.
Okay, that's great. And the podcast I saw is on Apple, Google Podcasts, and Spotify.
Spotify. Yep.
Awesome. And then I would want to mention too that you also have another download available on your website, 5 Tips for Better Sex. It's a 10-page PDF I will tout that in our group as well for our women. And so we are looking forward to going through all that information, and just thank you for sharing so freely and graciously with our community, with women at large, and keep up the good work, Dr. Kelly.
Thank you. You too. What you're doing is incredibly important. Incredibly important. So
it's a huge blessing to be able to connect with so many medical professionals that are really passionate about helping our women. So I'm really, really grateful for this time in my life, for sure. So thank you. And I hope that we can talk again. And just thank you so much for your time today.
Thanks for having me.
Thanks. Okay, guys, this is Jan James for Hope After Breast Cancer podcast signing off. Take care. Have a good day. Girlfriend, thank you so much for listening to our podcast. I hope you found some nuggets to encourage you and give you hope. Make sure you subscribe to the podcast. You never want to miss an episode, and we'd love to know how we're doing, so please be sure to leave us a review. Until next time, this is Jan James encouraging you to remember there is hope after breast cancer. See you next time.